This briefing introduces an academic project for the Master of Pharmacy program at Universitas Islam Indonesia for the even semester of the 2025-2026 academic year. This presentation fulfills the assignment requirements for the Pharmaceutical Care course, code MFA 206. This course is instructed by Professor Dr. Vitarani Dwi Anandaningrum. A persistent challenge in pharmaceutical care is ensuring clinical teams have immediate, accurate drug information at the point of patient care. Solving this requires translating academic clinical standards directly into fast-paced hospital workflows. Master student and pharmacist Setya Devi Wulandari compiled this presentation. The proposed solution for this assignment is an initiative called PIO-Connect. PIO-Connect operates as a digital ecosystem engineered specifically to manage drug information services within a hospital. By pulling fragmented reference materials into a single hub, it automatically routes verified drug data out to pharmacy teams, inpatient wards, and hospital administration. This eliminates scattered manual reference checks in favor of a dynamic, unified network. The upcoming presentation breaks down the practical utility and technical architecture of the PIO-Connect system. Developing this framework directly addresses the advanced master's level requirement to operationalize pharmaceutical theory into tangible clinical systems. When clinicians have instant access to this integrated data, hospitals can rapidly accelerate decision-making and significantly reduce the risk of dangerous medication errors. The following sections detail the core modules and deployment strategies for this platform. Applying academic rigor to digital infrastructure builds scalable healthcare solutions. Let's begin the technical review. Think about the physical route a pill takes traveling through a hospital. It is not a straight line. It's a complex, high-risk relay race. Every time that medication changes hands, from the compounding pharmacist to the ward nurse, and finally to the patient's family, critical information is at risk of being lost in the transfer. This timeline illustrates a standard medication route. The red gaps represent dangerous clinical blind spots caused by fragmented communication. To eliminate these, Setya Dewi Wulandari developed PIO-Connect, a closed-loop ecosystem tracking a single medication continuously without dropping the signal. By forcing a fragmented process into a single enclosed environment, the hospital closes the gaps where errors occur, securing the flow of information across every handover. The journey starts at the absolute source, upstream in the pharmacy compounding room. Right now, in many modern hospitals, highly trained medical staff still rely on standard pocket calculators to determine complex injectable medication doses for children. A single decimal error in those manual calculations can lead to undetected drug interactions or severe fluid overload in a newborn infant. PIO-Connect prevents this by deploying Module 1, Smart-Dispensing. It runs on a Clinical Decision Support System, or CDSS, which acts as an automated digital safety net. This diagram shows the new workflow. A pharmacist inputs basic prescription data, and the CDSS instantly expands that text into a full matrix of clinical recommendations. It automatically isolates safety parameters, flagging exact solvent volumes and generating warnings for pediatric syringes before mixing begins. Once those parameters are verified, the system locks them in and prints a physical label, guaranteeing the compound formula is entirely accurate before it ever leaves the room. Swapping a manual calculator for a digital clinical assistant at the very start of the process prevents a chain reaction of fatal errors from ever reaching the patient. With the medications safely prepared, we move midstream to the nursing ward. Here, the core challenge shifts from chemical preparation to clinical communication. Pharmacists and doctors are constantly pulling each other aside for rapid interventions in the hallway. But because physical forms are dense and time-consuming, these crucial conversations are rarely written down. When that vital data vanishes, compiling monthly hospital accreditation reports turns into a multi-day administrative nightmare. PIO-Connect addresses this with Module 2, Voice Log. It is a frictionless recording tool designed specifically to capture that lost clinical data without slowing down the medical staff. As illustrated here, a pharmacist taps a single digital button to actively record the real-time sound of their clinical consultation. Once the conversation ends, the system automatically transcribes the audio, mapping the resulting text directly into the correct fields of a digital form. By completely eliminating the manual typing barrier, Administrative work that used to take days is finished in seconds, ensuring every critical medical decision is permanently documented. PIO-Connect successfully integrates high-level clinical pharmacy expertise with frictionless technological efficiency. Upstream, the ecosystem has mathematically guaranteed precise dosing. Midstream, it has successfully secured vital communication data. The high-risk relay race we started with now has a structural framework designed to keep the baton in hand through every transition. Prescribing the correct drug is only the first step. Clinical safety depends on the integrity of the data chain connecting the pharmacy to the patient. But the medication's journey is only half over. It is leaving the ward and heading downstream, out toward the patient waiting at home. We tend to view a patient leaving the hospital as a success, but the moment they step through those doors and head home marks the most vulnerable stage of their medical journey, the downstream phase. This creates a dangerous operational paradox. A hospital spends immense resources diagnosing and treating a patient, but the exact moment the patient is left alone to manage their own recovery is when the hospital's systemic oversight breaks down. Consider an elderly patient sent home with 15 different prescriptions. Each drug has its own specific timing, dosage, and dietary requirements. In medicine, this extreme overlap is called polypharmacy, and managing it requires near-perfect execution. When patients try to manage this alone, the system fails in predictable ways. First, patients simply forget their complex schedules. Second, hospitals often try to solve this by forcing elderly patients to navigate app stores and download specialized tracking software, creating a significant technical barrier. But the third failure point is the most dangerous. Without professional oversight at home, overlapping prescriptions can cause toxic drug interactions that go unmonitored. If a hospital cannot reliably track what happens after discharge, the clinical effort is compromised the moment the patient walks away. The care cycle must be closed. This data flow shows the mechanics of the PIO-Connect solution. A pharmacist inputs the complex, overlapping drug list into the system. The software synthesizes those variables into a single, safe timeline and generates one unique QR code. At home, the patient or their family members simply point their standard smartphone camera at that generated QR code. There are no app stores involved. The system functions as a progressive web app. By removing the requirement to download and install new software, the primary technical hurdle for older demographics is bypassed. Once active, the phone sounds an alarm when it is time to take a specific pill. To turn the alarm off, the patient must press a confirmation button. That precise timestamp is instantly transmitted back to the pharmacist's dashboard at the hospital. This two-way communication loop removes the cognitive burden of memorizing schedules while securing real-time clinical oversight for the pharmacy. To see how this affects the life cycle of a prescription, we can map the PIO-Connect ecosystem against conventional pharmacy methods across every phase of care. This matrix compares the workflows. Upstream, instead of relying on human memory, pharmacists use a clinical decision support system to catch prescribing errors. Midstream, speech-to-text AI logs consultations, listing compliance over 95%. Downstream, app downloads are replaced by QR access and automated safety layers. This graph plots the administrative impact of automating these phases. The time required to generate monthly clinical reports drops from 12 hours down to less than 30 minutes. That gives pharmacists 11.5 hours back every single month, time they can return to direct patient care. You might assume that running speech-to-text AI and real-time clinical tracking tools would be prohibitively expensive for most facilities. This financial breakdown shows otherwise. Operating this ecosystem in a single hospital costs between 500,000 and 1 million rupiah per month. Because the system is built on an agile, cloud-based infrastructure, it requires no expensive local servers or specialized hardware. This pricing model removes the accessibility barrier, making elite patient safety systems viable even for regional hospitals with limited public budgets. When an entire hospital begins operating with this level of precision, the benefits reflect in macro-level clinical outcomes. The software filters out weight-based dosing errors in pediatric care, while the notification system increases daily schedule adherence in geriatric wards. By securing the demographics most vulnerable to medication errors, regional hospitals can systematically meet the highest national accreditation standards. Over the next decade, this technology is designed to evolve from an isolated hospital tool into an interconnected national health network. Upstream, these localized nodes will establish seamless data integration with the Ministry of Health's centralized Satu Sehat platform. Midstream, the system will incorporate ambient clinical intelligence to autonomously document complex clinical discussions without the pharmacist needing to manually log data. Downstream, the architecture will expand into a national telepharmacy platform, connecting patients in remote areas directly with specialized pharmacists. This trajectory shows how a platform designed to fix local errors can scale to bridge the safety gap between urban centers and the country's most remote regions. PIO-Connect closes every vulnerability gap in the life cycle of a prescription, tracking it from the hospital pharmacy to the patient's home.
Baik, saya akan menjelaskan terkait website yang saya buat yang dinamakan adalah PIO-Connect. Dalam website PIO-Connect ini terdapat 3 modul di dalamnya yang menyesuaikan terkait dengan kebutuhan rumah sakit. Alasan dibuatnya 3 modul ini, yang pertama adalah kekurangan SDM, yang kedua adalah kekurangan alat canggih di rumah sakit, yang ketiga adalah pasien-pasien yang membutuhkan perhatian khusus seperti pasien geriatri dan pediatri seperti itu. Untuk modul pertama itu adalah modul Smart-Dispensing, yang dimana kita hanya menginputkan resep, kemudian akan melakukan proses sendiri CDSS-nya yang bahkan menghasilkan output rekomendasi dan beserta laba resep. Modul kedua adalah voice log PIO. Jadi PIO kita hanya menggunakan rekaman suara, dan dari rekaman suara tersebut akan menghasilkan teks otomatis yang dapat langsung dikirimkan ke Simona seperti itu. Kemudian yang modul ketiga ini adalah Smart Research. Jadi kita memasukkan polifarmasi atau obat pulang yang diterima pasien. Kemudian tanpa harus mendownload aplikasi akan muncul kode QR dan itu akan memunculkan alarm di HP pasien seperti itu. Alasan kenapa ini khas di rumah sakit bukan di apotek komunitas ada 3. Yang pertama itu karena IV administratif pediatrik ini hanya terjadi di RS. Kemudian untuk PIO ada target akreditasi dari KARS yaitu PKPO nomor 4 yang menuntut jejak digital PIO itu lengkap dan telusur. Kemudian yang terakhir itu adalah polifarmasi geriatri. Jadi kombinasi obat ini sangat banyak terjadi di rumah sakit dibandingkan apotek komunitas seperti itu. Mungkin langsung saja ke modul yang pertama yaitu Smart-Dispensing. Jadi di modul yang pertama ini kita tinggal hanya memasukkan ada 11 antibiotik yang bisa digunakan di rumah sakit. Kita tinggal pilih ada ampicillin, ceftriaxone, ceftriaxone dan seterusnya. Contoh saya masukkan misalnya ampicillin. Nanti dosisnya bisa dimasukkan dosis berapa. Nanti anaknya usianya disesuaikan apakah dia neonatus, bayi maupun anak. Kemudian berat badannya bisa dimasukkan misalnya 5 kilo seperti itu. Dosisnya misalnya 1000 mg seperti itu. Nanti akan keluar apakah dia harus pakai siring pump, apakah harus pakai drip infus. Karena kan selama ini semua pasien anak itu kita pukul rata pakai otsum 100 ml. Padahal sebenarnya untuk anak-anak tertentu seperti bayi dan neonatus kadang bisa resiko udem atau kelebihan cairan. Makanya kadang perlu menggunakan siring pump. Meskipun juga untuk siring pump perlu perhatian khusus apakah spet yang digunakan itu sudah benar atau belum, karena kadang kalau spetnya terlalu kecil konsentrasi dari antibiotiknya terlalu pekat malah resiko skin test positif untuk anak tersebut seperti itu. Jadi di sini akan keluar rekomendasi spet apa yang disarankan, berapa volumenya. Jadi kita hanya memasukkan dosis dan berat badan udah keluar rekomendasinya pakai spet berapa, volumenya berapa, jadi otomatis seperti itu. Kita tidak harus menghitung pakai kalkulator manual. Berikut adalah 11 antibiotik yang saya masukkan ke dalam website yang saya buat, karena memang 11 antibiotik ini yang digunakan di rumah sakit seperti itu. Kemudian untuk masuk ke modul yang kedua yaitu voice log. Dari voice log ini kita hanya menekan satu tombol saja. Jadi tidak ada lagi kita harus mengetik atau mencatat manual untuk PIO itu nggak ada. Jadi tinggal klik satu tombol ini, dia akan merekam secara otomatis apa saja yang ditanyakan ke kita sebagai apoteker. Contohnya misal ketersediaan obat, apakah interaksi, apakah jam, segala macam. Nanti ketika kita sudah selesai ngomong di sini, ini bakal langsung mengekstrak ke data dokumen gitu. Jadi ini contohnya saya isikan demonya ya. Jadi semua akan terisi secara otomatis, siapa yang nanya, unit kerjanya di mana, uraian pertanyaan seperti apa. Jenis permohonan juga bakal terkategorize otomatis, apakah dia masuk ke harga dosis, harga obat dosis, apakah masuk ke perhitungan farmasi dan lain-lain. Jawabannya juga akan langsung terekam, referensi juga langsung ada, dan siapa yang memberikan jawabannya juga ada. Misalnya ini APT Setya langsung ada otomatis, dan kita langsung bisa cetak PDF-nya ketika ini dibutuhkan saat akreditasi nanti. Contohnya seperti ini, formnya ini sudah disesuaikan dengan format yang ada di rumah sakit seperti itu. Jadi tidak ada lagi kita harus mengetik manual, tinggal satu klik udah jadi semua untuk dokumennya. Itu untuk modul yang kedua. Modul yang ketiga, biasanya kan pasien pulang banyak bawa obat ini, dan apoteker bisa ngisi, ini ada 15 kolom, bisa isi secara manual, misalnya satu-satu diketik, misalnya amlodipin dan seterusnya, atau mau sinkronis dengan SIM rumah sakit, misalnya ini otomatis ya, langsung masuk 15 obat. Nanti kalau kita mau mulai ulangin lagi bisa dikosongkan. Ini saya contoh, misalnya ada pasien 72 tahun geriatri dengan nomor rekening sekian, dengan diagnosa Parkinson, epilepsi dan GERD segala macam. Dia kan ada polifarmasi ya. Kita tinggal generate etiket dan jadwal. Nanti keluar mana yang interaksi, apakah high, moderate atau low. Nanti jadwal minum obatnya juga bakal keluar jam 6, jam 6.30, jam 7, jam 15 segala macam. Nanti kita tinggal klik ini untuk scan, langsung muncul. Ketika kita klik ini langsung scan, ada jadwalnya ini. Jadi pasien tuh langsung otomatis ada web ini keluar di HP-nya tanpa harus download aplikasi di Play Store. Jadi tinggal satu klik langsung ada alarm di HP-nya. Gitu. Simulasinya ini ketika alarm itu berbunyi, dia tahu Prosemed harus diminum jam 6. Kalau dia nggak minum, kalau dia nggak klik ini berarti dia nggak minum. Jadi dia harus klik konfirmasi minum obat ini, baru alarmnya baru mati. Gitu. Jadi ada data kepatuhan juga dari pasien yang bisa disinkronis ke apotekernya seperti itu. Jadi ini ada 3 modul dalam satu website, yang kemudian nanti di akhir ada dashboard Simona. Ini kita bakal tahu kategori tren PIO-nya seperti apa, apakah banyak di interaksi, apakah di dosis, ESO, indikasi, stabilitas, dan lain-lain. Kemudian untuk biaya operasional website ini saya perkirakan sekitar 500.000 kita per bulan. Kalau mau update database tinggal upload Excel aja, jadi nggak perlu admin IT segala macam. Apoteker bisa langsung update database sendiri. Kemudian untuk skalabilitas nanti mungkin bisa diintegrasikan di satu sehat seperti itu.